Imagine you have gradual or sudden knee pain and you go to see a medical professional. They examine your knee, an x-ray is normal, they prescribe some medications and hopefully some physical therapy. After a month, you're not noticing much improvement, so an MRI is ordered and it reveals a meniscus tear or degenerative arthritis. Bingo! They tell you you'll be back on your feet in no time after they simply insert some small tubes into your knee and then put in some instruments to remove the torn fragments and degeneration in your joint. Makes sense, let's do it, right? In fact, close to 1 million people in America alone have this done every year. Not so fast, not so fast. We've known since 2002 when a study was published looking at SHAM surgery for degenerative arthritis of the knee, where they go in with a scope and clean out the fragments of the joint, that it's ineffective. In the study, what they do is open up half of the people's knees, clean out the arthritis, do the typical procedure, and then for the other half of the people, they open up the knee, spend the same amount of time in, but don't actually do the procedure at all. When they follow those people out for the length of the study, they found no significant difference between the individuals that had the knee surgery performed and those that had the placebo or the sham surgery. Then in 2013, researchers wanted to see if the same thing would be found if they did the procedure with a sham for meniscectomy, or removing part of a torn meniscus. Naturally, you'd think if you have a torn meniscus, you had the torn piece removed, it should help you, right? Well, guess what? When they followed the sham group with the surgical group for the length of the study, they found no significant difference between the individuals who had the surgery and those that had the placebo or the sham surgery for meniscectomy. But Tim, what if I have degenerative arthritis and a meniscus tear? Surgery must be needed then, right? Well, in 2020, researchers published a study that looked at 5-year follow-up from 2 groups. One group, arthroscopic meniscectomy and debridement of the knee, followed by 12 weeks of therapy. The other group, no surgery, no sham surgery either, just 12 weeks of physical therapy for strengthening. At the end of 5 years, there was no significant difference between the groups. Perhaps more interestingly, the group that had the surgery ended up with a higher rate of total knee replacements at the end of the 5 years. This falls in line with the theory that's been believed for years that by removing some of the meniscus, you end up with a higher rate of arthritis and degeneration because you lose some of the shock absorption in the knee. And it's possible that had you left a meniscus tear in the knee and just went through strengthening programs, you may have been able to delay, at the very least, that total knee replacement surgery. And since they only last for so long, it's always better when you can delay the need for total knee replacement. All of this on top of the standard risks like bleeding and infection that go along with any surgery. Not to mention, each surgery costs between $5,000 and $10,000, and multiply it out over the nearly 1 million that are done per year, you're in the billions and billions of dollars range that could be saved for the healthcare system. But Tim, I had arthroscopy and it helped me. But guess what? So does the sham surgery. The placebo effect is an incredibly powerful thing. No matter what you do, you're going to improve when you have time and when you have strengthening exercises that are associated with your recovery. If you take nothing else away from this video, take away the fact that people get better when they work on gradual strengthening and improving their mobility. It may take longer than you like in this immediate gratification world, but you will improve when you continue to move and you continue to strengthen. But my doctor said I need the surgery. Exactly. And that's why it's your job as the patient to ask questions to make sure that your body being cut is the appropriate thing to be done. Surgeons are essentially at the top of the medical totem pole, and for good reasons. They're incredibly bright individuals, and they've worked hard through dedication and effort to get into the position they're in. But if the person at the top of any totem pole is never questioned, bad decisions are made and perpetuated. All you need to do is just simply say, hey doc, I've heard studies have shown that this surgery is no better than physical therapy or placebo surgery. Is that true, and what are your thoughts? If they have issues with it, then go get a second opinion. This is not to say that this surgery is never helpful for anybody, and it's never the thing that gets somebody over the hump. And that's why the conversation with your surgeon is so important. How long should I wait to look at other options? Well, pain drops off pretty considerably by 3 months and continues to drop somewhat significantly up to a year. The bottom line is this: regardless of how severe your symptoms are, where your arthritis is in the knee, how bad your x-ray is, whether or not you've had an MRI that showed significant meniscus tears, or the kind of symptoms you have, having an arthroscopy or a scope will not improve your chances of a positive outcome compared to a sham surgery or physical therapy for strengthening of your knee. It would be great if it did work because it's such a simple and quick procedure, but the fact of the matter is, it simply doesn't. I can tell you firsthand, I could barely squat past 70 degrees about 3 months ago, and now I'm back to full function doing loaded squats just by gradually increasing my range of motion and strength. To start working on strengthening your knee, reach out to a physical therapist or try a program on your own for strengthening of the knee, like Kneesovertoesguy's program. Watch this video where I review his program from a physical therapist perspective. If you want to keep improving, you got to keep it moving.